Okay, let's dive into this. Welcome to This Explainer. Today, we're taking on a massive medical mystery that affects so many people, often causing just absolutely debilitating menstrual pain. We're talking about endometriosis. For way too long, the intense pain that comes with this condition has just been brushed off or totally misunderstood. But today, we are going to transform this medical mystery into medical mastery. We'll give you a super clear, structured look at exactly what is happening inside the body.
I mean, just listen to this. Bleeding from the belly button or lungs during menstruation. Let that sink in for a second. We so often hear severe period pain normalized as just, really bad cramps. But we need to completely shatter that normalization right now. This is a shocking reality for some patients. This is not just a heavy period. This is a severe systemic medical condition where the body acts in totally unexpected ways. If you or maybe someone you know has been suffering in silence, let this validate the severity of what we're actually dealing with here. It is real and it is intense.
So, here is our roadmap for today to help make sense of it all. First, what exactly is endometriosis? Second, we'll look at the causes and potential complications. Third, medical treatment options. Fourth, modern surgical treatments. Fifth, why cases seem to be rising. And finally, number 6, seeking personalized care early.
All right, let's jump right into section 1. What is endometriosis? It's time to actually identify the villain here and bring some empathy to those suffering in silence.
Here is the core medical definition. Normally, the inside lining of the uterus, which is called the endometrium, thickens and then sheds every single month if a pregnancy doesn't happen. That shedding, that's your normal menstrual period. But in endometriosis, tissue that is remarkably similar to that uterine lining starts growing outside the uterus. Because this rogue tissue responds to the exact same hormonal signals, it also tries to thicken, break down, and bleed every month. But here's the kicker. Unlike normal menstrual blood, this blood has absolutely nowhere to exit the body. The result? Intense inflammation and truly severe pain.
And this brilliantly illustrates how this rogue tissue doesn't just stay near the reproductive organs. Yes, it can grow on the tissue surrounding the uterus or maybe inside the ovaries, but it can also literally attach to the intestines. And in highly bizarre, severe cases, it can even implant in the belly button or the lungs. That is exactly why we talked about that shocking quote a minute ago. If this endometrial tissue implants in the belly button, it will bleed from the belly button every time the patient has their period. If it's in the lungs, a patient might actually cough up blood during their cycle. It's just incredibly invasive.
Which brings us to section 2, causes and potential complications. Let's look at the mechanics of this disease and how it wreaks havoc inside the body. Now you might be wondering, how on earth does this tissue get to the lungs or the belly button in the first place? Well, surprisingly, the medical community still doesn't know the exact, definitive cause, but there are 2 prevalent theories that explain this spread. The first theory suggests that tissue outside the uterus, for some totally unknown reason, spontaneously transforms or mutates into endometrial-like tissue. The second theory proposes that actual endometrial cells from the uterus somehow enter the bloodstream, travel like little passengers through your circulatory system, and then latch onto new organs. It acts almost like a tumor in that way, though it is absolutely crucial to note that this is not cancer. When this displaced tissue ends up inside the ovaries, it creates a very specific visceral complication called a chocolate cyst. Imagine that endometrial tissue inside the ovary bleeding every month. Because that blood is trapped inside the ovary with nowhere to go, it just pools and collects. Over time, as that old blood sits there, it oxidizes. It turns this dark brown color, honestly resembling chocolate syrup. These cysts cause the ovaries to swell up significantly, and they can be a massive source of chronic, immense pain. But the complications definitely don't stop at cysts. Endometriosis leads to severe internal scarring and something called organ adhesion. This is where the endometrial-like tissue basically acts like a glue. It causes organs like the ovaries, the uterus, the fallopian tubes, and even the surrounding intestines to physically stick together. When these reproductive organs are fused together by this rogue tissue, they just can't function normally. For instance, the fallopian tubes might be totally blocked from properly catching an egg released during ovulation. This makes endometriosis a leading and deeply frustrating cause of infertility.
Okay, let's pivot to some hope. Section 3, medical treatment options. Let's look at the modern medical arsenal available to patients today. Now, what's really interesting about this slide is the clear contrast in treatment philosophies. On one side, we have painkillers. For a long time, patients were basically just told to take a painkiller and push through. But painkillers only mask the symptoms, right? They do absolutely nothing to treat the underlying disease. On the flip side, we have hormonal therapy. Because endometriosis literally feeds on the female hormone estrogen to grow and multiply, hormonal therapy actively fights the root of the problem. It controls those hormone levels and prevents the disease from getting worse.
Within hormonal therapy, there are two main targeted approaches. First up, you have low-dose contraceptive pills. These work by suppressing ovulation, which prevents those massive estrogen spikes that cause endometriosis to flare up. Second, for the really severe, debilitating cases, doctors might use much stronger drugs. These actually block pituitary commands entirely, basically shutting down menstruation. Now, this definitely stops the disease in its tracks, but it does mean navigating some temporary menopause-like side effects.
Moving right along to Section 4, modern surgical treatments. Because sometimes surgery is the highly effective option we need.
Doctors usually recommend surgery if those chocolate cysts we talked about have grown just too large for medication to handle, or if a patient wants to get pregnant immediately and needs those physical blockages cleared out right away. And I really want to reassure you here, modern surgery is far less daunting than it was in the past. Thanks to minimally invasive, laparoscopic, and robotic-assisted techniques, surgeons can now operate through tiny, tiny incisions. That means no major scarring and wonderfully short hospital stays. Instead of spending 10 to 14 days recovering in a hospital bed like patients did decades ago, many can actually go home within just a few days.
Let's move to and see how this builds into Section 5, why cases are rising. Let's contextualize why this condition seems so much more common now than 50 or 60 years ago.
So there are two primary factors driving this surge in diagnoses. The first is environmental. Medical experts point to a big shift toward westernized high-fat diets, which are believed to actually influence our hormone levels and contribute to the rise of this estrogen-dependent disease. But the second factor? It's technological, and it's actually a really positive thing. Historically, unless a doctor went in and performed invasive surgery, endometriosis was incredibly hard to see. Today, we have widespread access to advanced ultrasound, MRI, and CT scans, so we aren't necessarily seeing a sudden localized epidemic out of nowhere. Rather, our diagnostic technology is finally good enough to catch what was previously totally invisible.
And that perfectly leads us to our final section, Section 6, Seeking Personalized Care Early. It's all about empowering you to take control of your health journey. Finding answers really doesn't have to be intimidating. It starts with a very straightforward diagnostic process. Often, just a standard pelvic exam combined with a basic, highly accessible ultrasound can immediately reveal if the uterus is enlarged, if cysts are present, or if organs are tethered together. And hey, if the ultrasound isn't totally conclusive, doctors can easily step up to high-accuracy CT or MRI scans, which boast an incredibly high diagnostic success rate. The point is, you don't have to stay in the dark.
So the crucial point is this: treatment is never, ever a one-size-fits-all scenario. Just because a friend had a specific surgery or took a specific pill absolutely does not mean it's the right path for you. Care is entirely tailored to your specific life goals and your family planning timeline. For instance, a patient who says, "I want to have children in 2 to 3 years," they're going to receive a very different treatment plan, perhaps prioritizing immediate surgery to clear those adhesions, than a patient who says, "I am not planning for more children," who might benefit a lot more from long-term hormone suppression. It is deeply, deeply customized. Before we wrap up, I just want to take a moment to echo the profound empathy shared by the medical professionals who treat this every single day. As the doctor in our source material noted, men are incredibly fortunate to never have to experience this type of severe systemic pain. If you are out there experiencing debilitating cramps that literally stop your life in its tracks, your struggle is valid. It is real. And most importantly, you do not have to just endure it alone, and you certainly don't have to accept it as normal.
Which brings us to our final provocative thought for this explainer. Armed with all this knowledge about how endometriosis spreads, how it damages the body, and the incredibly advanced tools we now have to treat it, the next step is entirely up to you. Will you prioritize your health and seek an early consultation before the pain takes over? Please, don't wait for the symptoms to become unbearable. Reach out to a medical professional, get that ultrasound, and take back control of your life. Thanks so much for joining me on this explainer. And remember to always keep asking the right questions about your health.